Hello everyone, welcome back to my YouTube channel, welcome back to another episode. You're joining me again on the way to A&E, back to the emergency department for another shift. Today we're going to be talking about the all-important question, are we over the peak and what will happen if we lift the lockdown measures? Are we going to have a second peak? Are we going to see a huge number of cases rushing into the department and will we cope? These are things I'm going to be covering in this episode, and we're speaking to some colleagues to get their input, speaking to a consultant as well to get some expert advice about this topic. All of us are obviously desperate to get back to some normality, see our family, friends, and really start living our lives again. It's been a really, really difficult time, and you've all done so amazing. I want to say that as well. You have made a big difference at home, so thank you. I mean, for me, even getting my hair cut is a huge thing I want to do. I mean, look how bad it is. Absolutely dead. I'm very tempted to shave my hair off, so jump in the comments and let me know if I should do that. Anyway, I'm just arriving at work now, so I'm going to go and get changed, and when we have a moment, we're going to speak to some of my colleagues, we're going to discuss some of these issues, and hopefully give you guys some clarity about what we need to do next. Let's go. Right everyone, so I'm joined by Alpha. He's one of the senior ED nurses here. Band 7's been here quite a long time.
Quite a long time.
He doesn't want me to say that too much.
You can say that, yeah, definitely.
He looks very young, but he's very experienced. Worked together now for like 4 years, isn't it?
Definitely, yeah.
And I wanted to speak to you really about and get your insight into what you think is going to happen now. Are we over the peak in terms of COVID?
Yes.
And what do you think is going to happen in the coming weeks and months?
Yeah, basically, not even basic, this is advancedly. We're going to cope very well because people have been following the government instruction to isolate. But the negative part of that is people have been at homes while they're supposed to be in hospital. We see on and off classic examples for people with massive injuries, head bleeds that have falls, not coming to hospital, resulting into them having to stay a bit longer in hospital without coming into the hospital in the first case. So yeah, we are ready for the peak is there, don't get me wrong, because we're having some news from nursing homes and so on and so forth, but it looks like EDs, we are ready to receive more patients as possible.
Because we are over, it clearly got busier and busier, and we're kind of over that level now.
Yes.
But like you said, there's the worry for us, I guess, and it's good we're over that level and people are staying at home and isolating. What we don't want is people to stay at home and clearly need to come into the hospital. And there's a case that, I mean, you mentioned to me just now, about someone who fell a number of weeks ago. What was that case?
Yes, definitely. That's a gentleman. I mean, I don't want to, of course, for confidentiality stuff. Somebody came into me and they had it for about 5 weeks ago. Basically, they were worried not to come to ED because of the COVID and the risk of it and the isolation, and they end up having a massive head injury, of course. Keeping it at home for such a long time. It's just something like that, and we have had some episodes that we've seen people with stroke and so on and so forth.
And heart attacks as well. I've seen patients who clearly had an episode of heart attack a few days ago. The pains carried on, and normally they come and they haven't. So it's a hard balance, isn't it? Because we want people to do really well and stay at home, and the reason we're over the peak is because everyone's done so well.
Yeah, definitely.
But if you're unwell, if you're thinking I'm not right in myself. Come to the hospital. That's the message.
Yeah, that's the thing. If you think you're not well, you are worried whatsoever, we are open 24/7. EDs are opened up for you guys. We have special areas. We have areas with COVID. We have areas without COVID areas. So everything is covered. So if you come into hospital, we think you are suspect to have COVID, we have special areas for you. And if we think you are not, then again, we have special area you can be looked after. The message we are sending is don't stay at home being sick unnecessarily. The NHS is there, the hospitals is there, emergency department is there to look after you. So please do come. You have Dr. Alex around, they're going to be sorting you out, and I will be around trying to see you.
It is a big worry, and I mean, I saw a case the other day. I don't think I told you about this, but I was called out to the outside area because there was a lady who was due to give birth, and she was too afraid to come into the hospital because of the worry of COVID, and I had to go out and explain to her, look, we've got areas that are, we keep low risk, because any symptoms of COVID, they're not in those areas. And actually, we've separated the departments as well. And of course, the maternity ward, it is so careful to make sure that they're not passing COVID to other patients. If you need to give birth, obviously you need to come to see us. If you're well, you need to come and see us too. So please don't think that our doors are closed. Locking down and isolating is really important. If you're unwell, come and see us. Now, the other thing I'd like to ask you before we get back on, to work. Obviously, this peak's coming over, and they're talking about this isolation lifting to an extent, right? Which means there's going to be more traffic of people. There's potentially going to be more cases. Do you think we'll cope?
Definitely we will cope. We will cope. For the first few days, it's going to be difficult because there's going to be a flux of patients coming in unnecessarily as was usual, but definitely we are very happy. We are open to see those sick patients that want to use our service. So we are, we are very, very well ready for that.
What we've done, I think, and I actually credit is mostly to you as senior nursing staff and also the consultants have worked on this, is how well we've kind of adapted the scenario. We've moved departments around so that we've got green areas with low risk or no risk of COVID, and we've got the red areas which are at risk or suspected COVID. And the flow of patients throughout those areas is like really streamlined now, isn't it? We've got like a clear plan. We've done it once, so if we have a second peak, we're almost more prepared in a way. Do you know what I mean?
Yeah, definitely, you're absolutely right. We are more prepared than before because the outbreak was we didn't know what to do. Yeah. This is very strange. What we're gonna do, A to Z, but so on. But the NHS have grabbed it in their hands, so now we know what to do. If you present to hospital, whatever we think you are, we got the right place, right environment, right doctor, right team to look after you, so that you can be discharged or get admitted safely back to your normal life. And that's what we've been doing every day, Alex. I think we are so used to this now, and we are more than ready for everything that's going to happen. Really.
Thank you, Alpha, so much. He's a fantastic senior nurse. And you looked after in some night shifts. Was there any trouble, or was any patients that give you trouble? This guy is always there looking after you. He's looking after all of us as doctors and nurses. So thank you so much.
You're welcome.
And let's go and speak to some other staff.
All right.
Right, guys, I'm now joined by Mr. Nigel Harrison, one of the ED consultants here. Has been my boss for several years, about 4 years now. Despite looking incredibly young, you've been here in the department for quite a number of years. How long have you been consultant again?
Too many.
Too many.
I've been here as a consultant 16 years.
16 years. That's pretty good. And Lewisham is quite a stressful place, isn't it, to work for that level of time?
Busy.
It's busy. How have things been over the last few months in compared to things you've seen throughout your career?
Certainly a very unusual experience with COVID-19 and the change in spectrum of patient attendances.
Would you have ever expected, you think, in your career to see something like this?
Well, as they say, this is a once in a 100-year occurrence. It's very unusual.
It is an odd thing to have happened. I think for me, because I'm obviously early on in my career, it's something I never predicted looking forward, let alone happening this quickly. Obviously, it's been ongoing for a little while now. We've seen, I think it's fair to say, kind of just going past the peak now at the moment.
Yes, I think we're on the downslope of the peak. We, of course, are concerned that there might be a rebound if social distancing is lifted too early, or even when it is lifted, people don't practice some degree of self-isolation when it's necessary.
Are you concerned about what the fallout might be? Say if we kind of lift measures too early and people kind of go and just go back to pubs or mix a lot. Is there a risk, do you think, the department could become overwhelmed, or how do you feel about that?
I think certainly we were challenged at the outset of the pandemic, and although we've learned quite a lot how to manage this, if it returns too swiftly, we are going to be in a very challenged situation again, and especially that we are downgrading a lot of the measures that we have employed over the last month or so. We would be able to ramp it up, but it will take some time again.
What are the main kind of things and lessons you think we've learned from that kind of first? Because obviously a few months ago we had people in pods outside the hospital. We were doing those kind of tests and we were sending people home if they were well, 1 or 2 admissions but not many. What do you think we've learned from that kind of rapid peak that we experienced before?
I think testing we've learned is very key, and now we are testing everyone who gets admitted to hospital. Because I think once we know for sure whether that person is positive, it helps us decide how best to manage and isolate that patient while he or she is in hospital, as well as after discharge.
Yeah, and I think absolutely, from almost like a junior perspective looking, I think we've kind of learned quite a lot, and we streamline patients, don't we, into kind of the red zone and green zone. A lot of you will hear me talk about this before. So the red zone, where they either have suspected coronavirus or confirmed coronavirus. Green zone, if it's for unrelated issues and there's a low probability. When do you think it's possible for us to go back to business as usual? Can you foresee that, or do you think this is going to be a long period of time of splitting zones and so on?
I think, as most have been saying, until we have specific treatments or a vaccination program in place, it's going to be difficult. Certainly we expect a diminution in numbers of COVID-19 type patients, and so we anticipate our return to normal activity with a degree of COVID-19 in the background. But a normalization of the situation is probably not until early next year.
I mean, it feels kind of crazy to think that way, but I mean, we look at it at the moment, it feels like we're swinging the balance constantly. Like we had a period of time where red zone had loads and loads of patients with coronavirus and not many other patients coming in. Then we had concerns actually where patients sitting and staying at home were actually really unwell, they needed to come in, and now it feels like the balance is going the other way. And of course we split our departments into different sections, and you kind of have to look at where the pressures are to decide, you know, which zone is most appropriate to be red zone based on the number of patients and other kind of factors. How does that decision process kind of happen? Are you doing like regular meetings with other consultants about?
Well, yes, so we look at the total numbers that have been coming in on a daily basis, as we did for Monday gone, and we've noted an increase in number of green type patients. So patients with regular medical issues rather than COVID has certainly sprung up compared to last week, and so we're now having to redesign our approach to how we divide staffing and the areas to cope with the ramping up of the numbers in the green areas.
Another thing, I guess, with a challenge that we faced as well is staffing. Obviously, you know, staff are becoming, you know, some staff become unwell with coronavirus. It's just a part of the risk that we take, I guess, on the front line. Obviously, we're using PPE. We're very fortunate to have the right PPE here, but obviously some people have become unwell. How has it been in terms of, because you manage the kind of rota, how has that been? Has that been a big headache with people becoming unwell?
Well, I've just learned that that we've had one of the highest number compared to other staff groups in Oxford, and that's not surprising entirely because we are in the front line of patient management with the disease. But indeed, we've had some additional staff join the emergency department to help cope with the surge in demand. But I anticipate that clearly if situation starts to normalise, we may lose those staff numbers, and it will be difficult to just plug them back directly into the service should we need to, as I've often said, ramp up our processes once again.
Yeah, it's been quite a learning curve and quite an experience, but hopefully we'll cope if there is a second peak. Obviously we're really hopeful that that won't come, and what we ask people to do really is to listen to kind of the measures that the public health are advising. You know, we need to think carefully about how we take the next steps so that we don't overwhelm the NHS. Thank you to everyone, of course, who has been following the distancing rules. It has made a difference because ultimately we've seen that in the emergency department. It has worked, so don't think that your efforts are not, you know, working. So thank you very much. Thanks for watching this episode. Please do comment, like and subscribe. Let me know any questions or things you want me to cover in the future. Thank you to Mr. Harrison for joining me today. Take care.
Okay.